Hi everyone, welcome to Access Prescriptor. In this video, I'm going to teach you how to improve the knee flexion in case if the patient comes with the complaints of pain, unable to bend the knee in flexed position, or any post-surgical cases or osteoarthritis cases. These are all the cases. This kind of knee flexion progression model, it will be useful in your clinical practice. Come on, I'll take you to the step-by-step approach. Each step I have shown a lot of progression and regression. Accordingly, you can make the person to perform. Hopefully this video will helpful to improve your clinical practice, and don't forget to like this video. So if you like and subscribe, it will encourage or motivate us to upload many videos like this. So first variation is cycling. Cycling, one of the important and very useful exercise to improve knee flexion range of motion. Also it helps to stimulate some cardiorespiratory fitness of the patient. So you can perform with this height, and for the progression you can slowly reduce the height to make the person to progress the knee flexion range of motion. So I prefer cycling could be the first choice of exercise. We can increase the height, and side by side we can decrease the height to progress the knee flexion range of motion, as well as it helps to activate the lower limb muscle and improve the cardiorespiratory fitness. So in level 2 we can use the slider to assist the knee flexion. For example, you can also perform in long sitting, also perform in supine laying, but basically you start with the slider and ask the patient to slowly bend as much as possible. Also you can use the band to hold the heel, assist by yourself. Pulling, increase the range of motion, decrease range, and increase the range of motion as much as possible, decrease. The same variation you can perform it in supine laying also. For third level progression, you can ask the patient to weight bear with the knee. So if the person can able to weight bear on the floor, you can perform, or else you can use some foam pad to keep it under the knee, or the patient to do as much as possible from quadruped this position to come to Vajrasana. Slowly you can progress the range of motion side by side. Some patient will complain pain behind the knee. For that time, you can use the towel to roll it like this and keep it behind the knee and ask the patient to sit back. It helps to perform range of motion as deep as possible comfortably without aggravating so much of pain. Once the patient you feel achieved this much, and you can ask the patient to in a kneeling position, sit comfortably as much as possible and come on. This way we can progress the knee flexion range of motion and slowly progress to full sitting. For further progression, we can also make this happen in a unilateral way. By holding the stick, slowly progress to perform it in a unilateral pattern. Now let's go to level 4. Level 4 is couch stretch. In a kneeling position, you can increase the feet height slowly by increasing the knee flexion range of motion. Initially, you can add the small round ball, and you can add bigger ball, and you can add some box or something to increase more height by increasing the depth of knee flexion. Fifth level progression is ATG split squat. For ATG split squat, starting with the support is advisable and increase the height as much as possible. From there, keep your leg forward. So we are focusing on improving the knee flexion range of motion. So it should not keep the rear leg so backward. You have to keep little forward. So we have to push the leg forward as much as possible to get the knee flexion range of motion with available range. But here one problem we face usually, ankle dorsiflexion limit your knee function. So here you can do one thing, you can elevate the heel by adding wedge box. You can perform this exercise. So this way you can target more of the knee flexion range of motion by eliminating a bit or assisting a bit dorsiflexion range of motion. So you'll get good amount of knee flexion range of motion. I would like to suggest you to reduce the height of this and ask the patient to perform as less height as possible, slowly by session by session. So final variation is deep squat. We can progress the deep squat by elevating this height, ask the patient to do slowly the squats and slowly progress the range of motion in a deep manner. So not everyone comfortable to perform it like this. So we can also use the assistance. Taking hand support, controlled down. Taking hand support to increase the deep squat. You can perform this with the hand support. So with the hand support, you can lean forward, you can increase the knee flexion range of motion slowly. So for further progression, we can also ask the patient to perform the reverse Nordic exercise. But keep one thing very clearly in your mind, doing this only doesn't help to improve the knee range of motion. Also, we have to strengthen and activate the hamstring, quadriceps and other muscle groups surrounded the knee and hip and ankle joint. Hope you learned something new. This is a step-by-step approach you can make the person to perform knee flexion completely. It's an active approach. So anatomically, we can see some possible changes, and permanently the person knee flexion range of motion will improve. The person also will get confident to perform the movement and effectively. And as I always says, this is not one way approach. We can improve the knee flexion completely also, which I showed knee flexion based example. Activating the hamstring, quadriceps, calf and other muscles around at the hip also plays crucial role in tolerate the load when the knee flexion movement performed in a functional task. So considering this factor, it is not necessary you have to follow from the first step to sixth step continuously. So wherever you want, you can start. Your patient may different. Each and every patient comes with certain goals, different perspective, different physical activity status, pain threshold and so many things. According to your patient needs and demand, utilize this effectively and share with me what are all the videos you are looking from us to improve your clinical practice. Drop a comment. We'll try to upload those videos to help you to improve your clinical practice. Thanks for watching. Happy learning.